Hi, my name is Dr. Michael Cohen. I'm a gastroenterologist at Physicians Regional Medical Center in Naples, Florida. I've been in practice since 1989. The first 22 years were in the Chicago area, where I'm originally from, and the last 9 years have been here in Naples at Physicians Regional. So my specialty is gastroenterology, and gastroenterology comprises taking care of patients with digestive disorders of various types. This includes not only caring for patients who are ill, but also doing preventative work, and we'll talk about that in a little bit. But that includes colon cancer screening, which is a very important part of our practice. Also includes the use of various techniques for screening for colon cancer, including colonoscopy, stool testing, etc. So the COVID pandemic has really thrown a curveball at the whole medical establishment, as it has our society in general. And one of the things that we're trying to do is to try to keep patients as safe as possible, but also be mindful of the fact that they still have needs, including diagnostic testing, etc. So we're trying to reach the balance between protecting them from being exposed to COVID, but also making sure they get what they need in terms of their diagnostic studies. So we took a lot of time to consider what measures would really be important for keeping our patients, our staff, and ourselves safe from this virus. So we undertook a program that I'm really quite proud of here. Patients who wind up needing endoscopic procedures are tested for the COVID virus in advance. So all of our patients can be reassured that when they come to the endoscopy department, the patients that are in that department along with them, and we are keeping social distancing as well, but the patients who are in that general area have been COVID tested and are negative. In addition, not only are we testing them, and of course if they're positive, we're rescheduling their procedure to a later date, but we are treating everybody as if they're positive even though they have tested negative. So we're wearing all the proper personal protective equipment. We're mandating the proper social distancing. So we really feel like we're doing everything possible. Nothing is going to be a perfect system, but we feel we're doing everything within our means to protect everybody. So one of the concerns that we have about the COVID pandemic is it's unfortunately led to some people delaying or canceling altogether diagnostic procedures or diagnostic tests or even office visits that are really important for either maintaining their health or helping them with a current illness. And obviously there's a balance, and we understand that we want to reduce exposure to the COVID virus as much as possible. But we try to encourage our patients not to be paralyzed by this, because we are screening everybody at the front door of the hospital and the clinic before they come in. All of our staff, including myself, is screened, including temperature check and questionnaire before we come in the morning. So again, we're trying to do all the measures that we can to keep patients healthy and safe. Unfortunately, when people delay important diagnostic testing, they're really putting their health in danger. And it's always a balance, and it's important to confer with your physician about that balance, but there are risks in delaying therapy, delaying diagnostic testing, just as there are risks in potentially exposing yourself to COVID virus. So again, if there's a diagnostic test that has been suggested because of certain symptoms or certain other tests that mandate it, we really implore patients, speak to your doctor, talk it through with them, and we're not looking to jam anything down people's throat, but we are trying to give them a balanced approach so they understand the risks and benefits. So what is involved in a colonoscopy? People have a lot of misconceptions and fears, and we'll try to debunk some of those for you. First of all, the test is painless. That is usually one of our patients' biggest concern. Is it going to hurt? And we can reassure them that because of the type of anesthetic we use, which is a very gentle but effective anesthetic, they will feel nothing during the procedure. The procedure itself takes about 25 minutes. The big day is the day before, which is the day of preparation. It involves going on a liquid diet, starting at breakfast time the day before. Means things like Jell-O, tea, broth, etc. You can have as much as you want. And then some sort of a laxative solution to drink that will clear out the colon. Most patients don't particularly like the clean out part, but as I mentioned to everybody, it's one day and one day that can save your life. So what's important to remember in relationship to COVID and the risk-benefit ratio and things like that is we have to remember there's other things out there that are threats to our health as well. In our field, one of the most important things is colon and rectal cancer. Most people don't realize that there's about 150,000 new cases of colon and rectal cancer in the United States per year, and about 50,000 deaths per year from colorectal cancer, which are really staggering statistics. We've made inroads in that by screening people for colon cancer, and there's some very good screening techniques, and in my view, these numbers should be way lower, because if people are getting screened, we're going to be able to find cancers early at a stage when they're almost 100% curable. If the diagnosis is delayed, there's much less likelihood that the cancer can be cured. So early detection and prevention are the keys, and as I mentioned, we've got some very good tools to accomplish that. So what are those tools? They include colonoscopy, which I'll talk about in a moment, and then there's several stool tests that have been used as well for screening. So colonoscopy is the most widely accepted screening tool for colon cancer screening. The advantage of colonoscopy is twofold. Number one, it's very good at diagnosing early cancers. So it's early detection, which as I mentioned is one of the keys to long-term survival. Not only is it good at early detection, but it's also excellent in terms of prevention. And the reason being is you can pick up polyps on a colonoscopy at a very early stage, and most cancers begin as polyps. So if we remove the polyps through the colonoscopy, we have therefore prevented colon cancer. So early detection and prevention, nothing better than colonoscopy. In terms of the stool test, the two that are most widely available are the Cologuard stool test. That has the advantage of being able to pick up both blood in the stool as well as abnormal DNA. Cancers and polyps will shed abnormal DNA in addition to blood, so it's got a twofold benefit. That test would be done every 3 years for colon cancer screening. And the third modality that I was going to mention is the stool for occult blood. It's called a fecal immunochemical test, also a stool test, and that will pick up blood in the stool. So the Cologuard test, which tests for both blood and abnormal DNA, will pick up both cancers and polyps, whereas the fecal immunochemical test is much more accurate just for cancers as opposed to polyps. So you don't get the prevention aspect. But I think it's widely accepted that the most accurate technique is the colonoscopy. The day of the procedure, patients come in and we put an IV into their wrist. When they get into the procedure room, we drip medication in, which puts them to sleep, and they pick out a good dream and would send them off to dreamland. And as I mentioned, the test takes about 25 minutes, and we're able to offer people immediate results and let them know exactly what we saw. If we do remove a polyp, for example, we always send it off to the pathology lab to be examined. That takes a few days to come back, but we can usually let the patient know at the time of the colonoscopy whether there's anything that we're concerned about. There's really not a recovery period. Most people wake up quite quickly from the anesthetic and are able to converse normally and have a chance to go over the results of the procedure with them. We advise people to sort of take it easy that day and kind of rest and relax, but they can eat and otherwise have a normal afternoon. So one of the things that we take care of as gastroenterologists are hemorrhoid issues. Many patients come to our office with symptoms that they think may be from hemorrhoids, or they've been diagnosed with hemorrhoids in the past, and we're faced with trying to help them with those situations. So my approach to patients with hemorrhoid issues is, number one, let's make sure we have the proper diagnosis, because there are times when patients think they have hemorrhoids and it's something else. It may be something minor, or it could be something even as significant as rectal cancer, but clearly making the proper diagnosis is important so that we can do the right thing for the patient. But once we've narrowed it down to being a hemorrhoid issue, there's a number of different options available. To my way of thinking, the two most effective options for definitive treatment of hemorrhoids are hemorrhoid banding techniques versus hemorrhoid surgery. Hemorrhoid surgery is a little bit more invasive, so I'll put that one aside for the moment, and I'll focus in talking about hemorrhoid banding. We in our practice use a technique called the O'Regan system, and the O'Regan system has been around for over 20 years, and I've been using it for about the last 15 years. I find it an outstanding way to treat hemorrhoids. The beauty of the O'Regan system is, although there are 3 treatments involved with the therapy, each are very simple and literally take about 2 minutes. I tell patients that they may expect a slight pinching or pressure sensation in the rectum after the rubber banding technique is done, but they really shouldn't experience any pain. The 3 treatments are separated by about 2 weeks each, and usually that's effective in about 95% of patients. And the type of symptoms that we're able to cure with this technique are rectal bleeding, rectal discomfort, and rectal itching, which are the major symptoms that we usually see from the hemorrhoids. If the patient has symptoms that are suggestive of other disorders, of course, we may suggest diagnostic tests just to rule out other issues beside the hemorrhoids. As I said, making the correct diagnosis is very important. But we've had very good success with the technique and continue to do it here at Physicians Regional. One of the great things about this hemorrhoid banding technique is the fact that patients really don't need any preparation prior to the procedure. They don't have to go through a clean out like they would for a colonoscopy. They don't have to be fasting. They don't have to undergo an anesthetic, so they can drive themselves to and fro. So it's very user-friendly and very easy on our patients. One of the most important decisions patients have to make in terms of where they're going to have their gastrointestinal procedures is how to choose a facility that they're going to feel comfortable with. And there's a lot of choices out there. We're blessed in this medical community with a lot of options. So I'll just explain why I think Physicians Regional is a great choice for people. First of all, our medical staff. The people doing the endoscopy are going to be experienced, board-certified physicians. We've got 4 board-certified, very experienced gastroenterologists who have been doing this for many years and are good at what they do. We've got 2 colorectal surgeons who likewise are board-certified and experienced and excellent at what they do. Second of all, the facility where we do our scopes here at Physicians Regional Hospital has been recognized by the American Society of Gastrointestinal Endoscopy's Unit Recognition Program for meeting the highest standards in an endoscopy unit, and we're the only unit in Collier County that has that recognition. Finally, you can rest assured that the anesthesia providers who will be taking care of you and providing the anesthetic for you are very experienced, outstanding professionals in their field. What I always tell my patients is that I had my own colonoscopy done here at our facility, and if I didn't trust them, I wouldn't have been here.